Hello, good morning viewers. Welcome to Talking Threads. I'm Dr. Mohammad Rehan, working as a general practitioner in Zulaka Hospital, Sharjah. We in Zulaka Hospital, we believe that patient education is very important. And in our hospital, we experience that many patients coming with a problem of lower back pain. So because of that reason, we invited our consultant neurosurgeon, Dr. Ravi Dadlani. So he is with us today, and he will share some important information about lower back pain. Welcome, Dr. Ravi. So how are you?
Thank you, Dr. Rehan. Thank you so much. Welcome to all our viewers to Talking Threads. My name is Dr. Ravi Dadlani. I'm a consultant neurosurgeon with Zuleka Hospital, Sharjah. And being a neurosurgeon, we deal with surgical conditions involving both the brain and several conditions of the spine. Now, we chose to discuss a very common symptom that we see on a daily basis in an outpatient clinic, namely low back pain.
Okay, doctor, can you tell us that why we choose this topic to discuss? I mean, why lower back pain problem is more important to you? Why you came to here to give this information?
Yes, so doctor, low back pain is probably the second most commonest neurological symptom that we see in the clinic after headaches. And we are seeing that the last several years that the incidence of low back pain has been gradually on the rise. To many of our viewers, it may seem quite confusing why we are discussing this very simple subject of low back pain when most of our viewers would sometime have experienced low back pain in their life. We all have. It's a very common problem. But we are here to tell you that low back pain does not only mean the kind of self-limiting sprain or muscle pull that you get, which generally recovers in a day or two with a little bit of rest and analgesics. We are here to tell you that low back pain can actually be a symptom of more ominous and dangerous disorders.
So, okay, doctor, can you tell us what can be the causes of lower back pain? I mean, can you highlight important causes?
Low back pain can be both a symptom and a diagnosis. As a symptom, it can be a symptom of problems arising in the body relating to several structures close to the back. For example, a kidney stone can present as a low back pain. Abdominal conditions can present as low back pain. Ladies with gynecological problems can have back pain. Even the elderly with patients with arthritis of the hip joints can present with back pain. But from all these, the commonest would be conditions which are relating to the spine. And that's the subset of patients that we are here to discuss about.
Okay, doctor. Tell us about what are the causes of the spinal back pain.
Yeah, so the commonest cause for spinal back pain, like I mentioned earlier, is a pull in the muscle or in the ligaments. Now, ligaments are these very strong, taut little structures which hold all the bones together. So you can get what is called a ligament strain or a muscle sprain. Both these conditions are very similar and cannot be distinguished clinically, but it basically means that either the ligament or the muscle is either pulled, torn, or injured by a minor incident like an overzealous workout at the gym, starting out with contact sports on the first day, or doing an unaccustomed physical activity. Any of these things could trigger something, and this is the kind of low back pain we are all familiar with. The best treatment for this would be bed rest 24 to 48 hours, give complete rest to that part. Over-the-counter analgesics, maybe some analgesic gels can be applied, and hot fermentation and things like that, and usually it recovers quite well in the majority of people. But sometimes sprains or strains can be so bad that it could persist even beyond 2 weeks. Now, this would be the commonest condition, but then there are several other conditions which can cause low back pain. For example, in the aging population, like people over the age of 60s or 70s, we see them coming with chronic low back pain, and usually this is a sign or a portent of degenerative spine disorders. What happens in these conditions is that as a person is aging, so does the spine. And with that, there are certain discs, which are structures which are present in between the bones of the spine. Those tend to degenerate. they dry up, they have cracks, and sometimes the discs can protrude outside and they can pinch a nerve in the back. This can also happen with overgrowth of bones and ligaments. And when pinching of nerve happens, especially in the low back, people start to experience back pain which radiates down the leg, especially at the back of the leg. And this is commonly known as sciatica. A lot of it's quite a popular term in layman's term. Sciatica, it's also a medical term. It indicates pinched nerves in the back. Now, this is one broad spectrum of problems with spinal back pain. The others would be conditions like tumors, for example. So there would be at least two different varieties of tumors that can happen, which can affect the spine and present as back pain. You could have tumors of the spine itself or surrounding structures as a primary spine tumor, or you can have tumors which are cancerous growths elsewhere in the body, and they could spread to the spine. Primary spine tumors again are of two varieties, the benign ones and the malignant ones. All these could present with back pain. Infections in certain parts of the world are extremely common. We see a lot of cases of tuberculosis or bacterial infections, and these could present with just back pain. Trauma can also present with back pain, and that is also quite self-explanatory. When you get an injury, you would have back pain. But I'm here to tell you two specific instances when a remote trauma that occurred several weeks or months prior, could present as back pain. For example, a lady of 60 or 70, postmenopausal lady with osteoporosis, if she had a minor injury, she would have back pain for a few days, and which would resolve. Generally, after it resolves, if there has been a spine fracture, over a period of several weeks to months, the curvature of the spine would change, which is termed kyphosis in medical terminology. And when the curvature of the spine changes, that leads to chronic back pains. Another example I could give you is when the bones of the spine, one vertebrae over the other, would slip after a remote trauma incident, an injury that occurred many weeks or months ago. And then this slippage would be quite slow and progressive, and as it progresses, it would cause more and more back pain. And there are several other more rarer clinical diagnoses which I wouldn't want to touch on, but these would be the varied diseases which can present with back pain.
Okay, doctor, are there any other causes or any risk factors which can increase the incidence of the lower back pain?
Yeah, Dr. Ryan, that's a very good point, because of late we have been seeing the incidence of back pain increasing dramatically. When I was training to be a neurosurgeon, we used to consider back pain as a symptom of the aging population. But of late, we've been seeing people in the adult working age groups as well as children presenting with back pain, and this is quite surprising. And I'll just tell you a few important reasons why this is happening. The first important thing I would like to talk about is smoking. We all know all the hazardous popular science facts about smoking, like it causes lung cancer and other things. That is true, but what people don't realize, and there's a lot of scientific literature coming out today, is that smoking can actually degenerate the spine much faster. So a person, a 40-year-old man, would probably have a spine that resembles a 60-year-old man. And this happens because smoking and the chemicals in it actually dry out and age the spine faster. So disc bulges, disc prolapses, pinched nerves is much commoner in the young adult population nowadays. Smoking also reduces blood supply to the muscles of the back, so healing after an injury or surgery is also delayed in these people. The second common condition that we see again in the young adult population nowadays is prolonged sitting. Modern jobs have become mostly desk jobs. We see dozens of professionals, especially IT professionals or bank professionals, people who need to sit at their job and at the desk for sometimes for prolonged periods like 10 hours or 12 hours a day. And that coupled with bad posture, lack of exercise, and lack of basic lifestyle modification can trigger chronic back pain. And this is the second population of patients that we see. The third important thing would be children. Now, of late, we've been seeing a lot of children all over the world presenting with back pain, and this was quite unheard of, say, about 10 or 15 years ago. And there's several reasons for this, but the most important one that social research has proven is that the heavy backpacks that the children need to carry to school every day. When they do carry the backpacks, many children do that on one shoulder, so it kind of gives an unequal distribution of weight on the spine. The second thing would be when they do carry backpacks, they like to hold it loose, so it's kind of weighing down on the spine, and that's bad. So the backpack has to be lifted up and be taut on the shoulders. So these are some of the things that we've been seeing off late, which has increased the incidence of back pain in the population.
Okay. Doctor, tell us what are the red flags when a person that who is having back pain, because sometimes it's a simple back pain, when he should go to the doctor, to show the doctor, and then where he should go exactly. I mean, because nowadays, sometimes if any problem happens, they don't know in the hospital where they should go. So if the person who is having back pain, when and where he should go.
Yeah. That's a very good point, Dr. Rehan. So some of the red flags what Dr. Rehan is talking about are symptoms which may seem innocuous at first, which may be only back pain, but there may be certain hidden hints there. So for example, if you would have, if a person were to have sciatic pain or pain radiating down one of the legs, that would be an indication to see a specialist for that condition, because that would possibly mean that there are pinched nerves in the spine. Other conditions that can give us a hint that it's not simple back pain would be prolonged back pain, which is continuing for several weeks to months, which isn't reducing in intensity, or the intensity keeps increasing. Other systemic conditions, like a person may be having low back pain associated with low-grade fevers or evening rise of fever, which is present over a period of time. A person could possibly detect a lump or tenderness of the spine at certain spots. Anybody who has had a previous tumor or a cancer removed from some part of the body is at a potential risk of having a spread of the disease to the spine. So these are some of the red flags. I think if people have any of these symptoms and back pain, I think they should see a specialist early on. I think neurosurgeons and spine specialists are the people who generally deal with most of these problems. So yeah.
Okay. Doctor, tell us that when a patient came to the hospital and he will visit the doctor, so how the doctor will proceed, how he will start to evaluate the patient and will go further for diagnostic and treatment management.
Yeah, so the first important thing when a patient comes to me with back pain, what I would do is a complete clinical examination. So we evaluate the spine, make the patient walk, check for any problems in certain postures. So if the back pain is increasing in certain postures or in certain positions, that's important. We look for any lumps and then do a complete neurological examination. Now, there are certain tests which we can do which would give us a hint that a person would be having one or more of the other more dangerous causes for back pain. Having said that, clinical evaluation today in the modern era of medicine with all the latest diagnostic tools remains the hallmark. We cannot proceed for any diagnostic evaluation without a proper clinical evaluation. There have been studies which have been done to show that even people as young as in their 30s or 40s would have changes on the MRI, which does not necessarily translate to a clinical problem because we are treating the patient, not the MRI.
Okay, doctor. Tell us about what are the diagnostic modalities. I mean, how we will proceed for the investigation like X-ray, CT scan, MRI. I mean, like today, mostly people they are afraid about the radiations, CT scan and MRI. They are claustrophobic and they are afraid to go. So tell us how we will tackle here in Zulakhan Hospital these type of problem and how we will proceed for the investigation.
Yeah. So the commonest diagnostic test that I would recommend to my patients would be an X-ray. Now, X-ray has its limitations. it gives us good idea about a general good idea about the way the bones are structured. It does not show us soft tissues like discs or nerves and things like that. So if there's an obvious major problem with the bones, we can identify on an X-ray. But that would be limited to say about 20% of all the diagnostic procedures we do. I think the vast majority of patients do benefit from an MRI scan. Like Dr. Rehan said, yes, people are worried about the MRI scan. It's a loud machine, and you tend to feel like you're getting into a tunnel or something. So there are people who feel claustrophobic. Generally, with a little bit of reassurance, playing soft music, earplugs, most people tolerate the procedure quite well. And for those who have severe claustrophobia, at Zuleika we are even doing MRIs under sedation with the help of anesthetists. And the MRI gets over within a few minutes, and the patient isn't even aware what happened. So MRI gives us an excellent diagnostic modality, which shows us not just the spinal cord but other soft tissues. It would be helpful in detecting degenerative conditions, tumors, or other problems with the spine. And it's very accurate to a degree of about 95 to 98%. The next modality that is available today is a CT scanner. CT scanner has limited utility in spine problems. So certain tumors are better visualized on a CT scan. We also do CT scans when we need to do surgical planning. When we need to put in certain instruments in the spine like rods or screws, we need a CT scan to plan for that. But by and large, MRI would be the mainstay of diagnostic modality.
Okay, doctor, tell us that how you will proceed for the management. I mean, initially when the patient will come, so you will plan first for the conservative management, like with the medication and some regular exercise, and what about the surgical treatments?
Yeah. So when the mainstay of low back pain, especially in the general population who are having limited restricted low back pain, which is not very chronic, the mainstay is generally medical management. Surgery is limited only to a certain population which does not benefit from medical management. So most patients would be given a treatment, say a course of about a week or 2 weeks. We would teach them certain lifestyle modifications, physical therapy, rehabilitation, certain exercises that they can do in the house, and all that would help. There are certain conditions definitely where surgery is the mainstay of treatment, conditions like tumors or severe degenerative conditions of the spine where people cannot even walk for a few steps. So those people would definitely benefit from surgery. The other modality that I would like to just briefly mention are spinal injections, and we give these sometimes, generally given by interventional radiologist or the anesthesiologist. Spinal injections are injections of steroids and local anesthetics which are injected in the spine at specific points on the spine where we can appreciate which are trigger points, which is based on various diagnostic procedures that we do, like the MRI. We can identify these points and then we can put in spinal injections. Now, most of these are quite temporary, but some patients do get relief for several weeks to months. And sometimes this can also be a diagnostic modality, like if we have two parts of the spine which are involved and we are not sure which one is causing the problem, injecting the painful one will give for the patient relief and help us diagnose the condition. But at the bottom of all this, and the treatment that underlies all this, I think is the most important aspect of physical rehabilitation and physiotherapy. There's an old adage in medicine where people used to say that once a spine patient, always a spine patient. Now this is not definitely true in terms of treatment, but it remains true in terms of lifestyle modification. So a person who is diagnosed with a spine problem, it would be very pertinent for that person to modify his lifestyle and do rehabilitation, sometimes lifelong. Physical exercises are indispensable.
Okay, doctor. Can you tell us what's the outcome of this treatment? I mean, either patient are benefited more with the medical treatment only, or every time they should go for the surgery. So, which treatment is more better, or just highlight in your experience?
Yeah. So most patients, whether we're dealing with medical line of treatment or surgical line of treatment, most of them do quite well. And the old myth that everybody who undergoes spinal surgery ends up paraplegic is definitely no longer true in the modern era of medicine. Most patients do very well. In fact, most of my patients, I would encourage them to get out of bed and start walking the very next day after surgery. We don't prescribe even prolonged bed rest nowadays. They do well, and I think chronic back pains after surgery or medical management is quite a rare thing.
Okay, doctor. In the end, just last question from my side: that what can be the preventive measures? What are the lifestyle modifications that either we can prevent this low back pain, or if a patient or person is having already a back pain, how he can reduce and he can improve his lifestyle?
Yeah. So this is, I think, the most important message for today's talk is that what the general person, the layman, can do to prevent encountering low back pain. Now, there are several things which we can do. Like I mentioned, people who need to work long hours at their desk, you use the rule of 20s, which means that every 20 minutes a person gets out of the desk, does some stretching exercises, walks, takes a drink of water or something like that, and gets back to sitting. This may not be practically possible every 20 minutes, but at least every hour to 2 hours. The rule of thumb in spine prevention is that we need to always keep the spine erect. Avoid bending forward or bending backwards too much in whatever activity one does. For example, while driving a car or sitting at the desk, we need to keep our spine erect. Using cushions as back support is another important and very effective way to prevent back pain. When we need to pick up something from the ground, for example, instead of bending over as most of us do, it would be very beneficial if we could just keep our legs apart a little, keep the back straight, and bend from the knees rather than from the spine. Quitting smoking is absolutely essential because there's a lot of research coming out talking about even when people who have normal looking MRIs but have chronic back pain. How do we diagnose that? But that is seen a very high percentage of smokers. So I think quitting smoking is an absolute essential need of the hour. And for children, like I mentioned, if you can avoid using heavy backpacks or using trolley bags with wheels, or at least adjusting the bag so that it's comfortable on the spine. These are, I think, simple things that we can do on our everyday life, to prevent back problems.
Okay. Thank you, viewers, and I believe this was very good session, and I will thank to Dr. Ravi that he shares a lot of good piece of information with us, and viewers, if you have any question about the lower back pain, you can comment on our Zulakhan Hospital website, and we will get back to you very soon. And thank you once again. Thank you all.
Thank you, Dr. Ria. Thanks a lot.